Atenolol has antianginal, antihypertensive and antiarrhythmic effects. The hypotensive effect lasts 24 hours. With regular use, is stabilized by the end of the second week of treatment, reduces heart rate at rest and during exercise. Indications: arterial hypertension, prevention of angina attacks, with the exception of princemetal angina pectoris. Cardiac arrhythmias, sinus tachycardia, prevention of supraventricular tachyarrhythmia, ventricular extrasystole. How to take course of administration and dosage. Assign inside before meals, without chewing, drinking a small amount of liquid. Arterial hypertension. Treatment begins with 50 mg of atenolol 1 time per day. To achieve a stable hypotensive effect, 1 to 2 weeks of administration are required. With insufficient severity of the hypotensive effect, the dose is increased to 100 mg in one dose. A future increase in dose is not recommended, as it is not accompanied by an increase in the clinical effect. With coronary heart disease, tachysystolic cardiac arrhythmias, 50 mg 1 time per day. Angina. The initial dose is 50 mg per day. If the optimal therapeutic effect is not achieved within a week, increase the dose to 100 mg per day. Elderly patients and patients with impaired renal excretory function require correction of the dosing regimen. Contraindications: cardiogenic shock, atrioventricular block 2-3 stage, severe bradycardia, heart rate less than 40 bpm, syndrome of weakness of the sinus node, sinoauricular blockade, acute or chronic heart failure in the stage of decompensation, cardiomegaly without signs of heart failure, princemetal angina, arterial hypertension, in case of use in myocardial infarction, lactation period, simultaneous reception of monoamine oxidase inhibitors, age up to 8 years. Efficacy and safety of the drug have not been established. Hypersensitivity to the drug. Special instructions. Monitoring of patients taking atenolol should include monitoring of heart rate and blood pressure at the beginning of treatment daily, then 1 time in 3 to 4 months. Blood glucose in patients with diabetes mellitus, 1 time in 4 to 5 months. In elderly patients, it is recommended to monitor kidney function, 1 time in 4 to 5 months. In patients with ischemic heart disease, abrupt withdrawal of beta blockers may cause an increase in the frequency of severity of anginal attacks, so stopping atenolol in patients with ischemic heart disease should be done gradually. During the period of treatment, it is necessary to refrain from engaging in potentially hazardous activities that require increased concentration of attention and speed of psychomotor reactions. Side effects from the nervous system and sensory organs: fatigue, weakness, dizziness, headache, drowsiness or insomnia, nightmares, depression, anxiety, confusion or short-term memory loss, hallucinations, decreased reactivity, paresthesia, convulsions, blurred vision, decreased secretion of saliva and lacrimal fluid, conjunctivitis, on the part of the cardiovascular system and blood, hematopoiesis, hemostasis, bradycardia, palpitations, myocardial conduction disturbance, AV blockade, arrhythmias, weakening of myocardial contractility, heart failure, hypertension, syncope, Raynaud's phenomenon, vasculitis, chest pain, thrombocytopenia, agranulocytosis, on the part of the digestive tract, dry mouth, nausea, vomiting, abdominal pain, diarrhea, constipation, abnormal liver function. From the respiratory system, shortness of breath, laryngeal and bronchospasm. Allergic reactions: itching, rash, erythema, urticaria, psoriasis-like and degenerative skin changes.